Let's turn to the latest on coronavirus. And Victoria remains the state with the highest number of cases, recording 21 new infections yesterday, including 6 of community transmission. Meanwhile, the cost of the COVID-19 outbreak is being felt throughout the economy, with hotel quarantine contributing to that cost. For more on that, Jessie Dorset is in Sydney. But first, to look at the new cases, reporter Elias Cluer joins us from Melbourne. Let's start with you, Elias. Other staff members at a quarantine hotel in Melbourne have tested positive, and that has health officials worried.
That's right, Michael. It's the 16th worker in hotel quarantine that's tested positive to coronavirus, and that, of course, includes the workers at the Rydges hotels in Melbourne. Now, the Chief Health Officer of Victoria, Brett Sutton, believes it's cause for investigation. Now, the latest worker was a staff member at the Stanford Hotel Plaza in Melbourne. Now, Brett Sutton believes that given there's been an uptick in the number of return travellers testing positive to coronavirus, that number 15 yesterday, as you mentioned, Michael, that the safety protocols for these workers at hotels should be reviewed to ensure they're not contracting it from the other people that are bringing it into these hotels. That figure of 200 people that have tested positive to coronavirus whilst in hotel quarantine.
Now, also a man in South Australia, Elias, has tested positive, but the state is saying their 22-day clean streak isn't affected by this. Why is that?
Yeah, that's right, Michael. Well, this 35-year-old man returned to Australia from Pakistan on the 6th of June and then returned a positive coronavirus case on the 9th of June. But he was released from quarantine 8 days later because he told health authorities that he hadn't been symptomatic since May the 26th. Now, the Chief Health Officer of South Australia, Dr. Nicola Spurrier, says that because he hasn't been symptomatic or shown symptoms for at least 3 weeks, she's not concerned, saying, quote, everything is fine. She also says that someone can test positive to coronavirus up to 8 weeks after the initial diagnosis.
OK, let's go to Jessie Dorset in Sydney. Jessie, good morning to you. The costs of hotel quarantine have been revealed.
Yeah, g'day, Michael. Every morning when we're talking about these coronavirus numbers, we hear about return travellers in quarantine. And that's because anyone flying in from overseas has to spend 2 weeks in a hotel like that one. Since late March, more than 25,000 people have been accommodated in New South Wales alone. So who's footing the bill? That'd be you and me, the taxpayers. It's cost the New South Wales government more than $50 million. The state is hoping to claw back at least $17.5 million from other states because New South Wales is putting up their residents before they return home. The Premier here, Gladys Berejiklian, has said she doesn't regret spending that money though because we're catching COVID cases before they enter the community, and the number of people in hotel quarantine has fallen dramatically since international borders have been closed and flights cut.
And we've also got some news on the broader economic impact this morning of the virus.
Yeah, Michael, the Australian Tourism Industry Council has put out some figures, not to do with international borders, but our state borders being closed. They say the cost to the economy is $84 million in lost GDP or 702 jobs a day. The biggest loser is Queensland, according to ATIC. It says that it's missing out on $21 million in GDP or 173 jobs a day. And I know, Michael, Lisa would agree with me here. There's some of us itching to get back to Queensland.
Indeed, lots of people are. Jessie Dorset, Elias Cluer, thank you both.
Authorities in Beijing are testing 350,000 people and say the outlook for the city's new coronavirus outbreak is still grim.
Around 150 people have been diagnosed with the virus just over the past week, and authorities have shut schools, cancelled flights and forced tens of thousands of people to quarantine at home. Here's the ABC's Beijing correspondent Bill Birtles.
Well, can you believe this? Just weeks after Beijing finally ended its restrictions for coronavirus, the masks are back on and the restrictions are back in place. This new outbreak has really spooked the city. It seems to have come out of nowhere. Authorities are yet to determine how the virus got back into Beijing after such a long time with no new cases. So you might have heard that Beijing is under a new form of lockdown, but it's not really the case. This is my ride home from work, and you can see there are still plenty of people out and about. Workplaces and offices are still open, And this time around, authorities are trying to avoid the broad lockdown that Wuhan copped in the early days of the pandemic. They're trying to target the high-risk areas. So about 30 compounds have been locked down. Mass testing is the go, and most flights out of Beijing have now been cancelled. Authorities really are trying to put a bit of a seal around the city to stop all non-essential travel and people who potentially could be spreading the virus to other parts of China. But for many here, it feels frustration more than fear is the main sentiment being expressed. Beijing has had more restrictive measures in place than pretty much any other Chinese city aside from Wuhan. And you have to remember, there are businesses here, things like karaoke, things like private education schools for children, which have never been given approval since the initial shutdown in late January to reopen. After the recent weeks where they started to loosen things up, many of the people who ran these businesses thought, finally, we're going to be able to get some relief, we're going to get back to business. And now this massive outbreak strikes Beijing and all those hopes have been dashed. So a lot of people in the Chinese capital feeling a huge amount of frustration about this latest outbreak.
One of the early centres of the coronavirus outbreak, Iran, now appears to be experiencing a severe second wave of the disease.
There are now more new cases being detected than at the height of the initial outbreak. Our Middle East correspondent Eric Torchek reports.
Iran was one of the first countries to experience a severe coronavirus outbreak. But after a deadly peak in late March and early April, new case numbers fell dramatically. Now they're going back up, and Iran is approaching 200,000 confirmed cases. A number of its provinces have been designated as red zones. There are a few reasons for this. The cash-strapped government, facing severe United States sanctions, has ended many restrictions on businesses and gatherings. Some officials say many Iranians are not complying with social distancing requirements anymore. And Iran has increased and improved its testing significantly. They're doing wider testing in the community, not just in hospitals, and picking up mild cases that wouldn't have been noticed in the initial outbreak. That last point likely explains why the death rate, which was scarily high in March, is not looking so bad this time around. Most cases now do not require hospitalisation. But while this second wave doesn't look as bad for Iran, the World Health Organization says there's a warning in it for other countries which are reopening. Make sure you maintain strict rules on social distancing and gatherings. If you don't, you'll see a similar spike.